Meschino, this is embarrassing. I have a bad case of PMS. Is there anything I can do to lessen the cramping?
PMS affects about 1/3 of young women, and in about 10% of cases they have really severe symptoms that can include debilitating menstrual cramps called dysmenorrhea. Now the good news is that some natural remedies can really help to prevent the problem and to relieve the symptoms. That's what I'm going to outline in this video. But what causes PMS and menstrual cramps in the first place? Very common finding is a high estrogen to progesterone ratio, about 5 to 10 days prior to menstruation. And that's due to too much estrogen synthesis, not enough estrogen detoxification by the liver, not enough progesterone being secreted by the ovaries. Any combination can cause that problem. Now, regarding menstrual cramps themselves, it's usually due to an increased release of prostaglandin series 2 by the endometrial lining about 1 to 3 days prior to menstruation. That prostaglandin series 2 causes muscular contractions of the uterine muscles, and they can be very severe and frequent and lead to pain. And prostaglandin series 2 can also cause inflammation and blood vessel constriction, which can also cause uterine pain and cramping. Now, MRI studies with women that have dysmenorrhea have shown that they have more intense and more frequent contractions of the uterine smooth muscle than women who don't have dysmenorrhea. So preventing the buildup of prostaglandin series 2 is a key part of the solution. Now, fortunately, some dietary changes and supplements can help you do that. So the overall game plan in terms of diet and supplementation for PMS and for menstrual cramps is the following. I like women to use a herbal supplement combination that has black cohosh, soy isoflavones, and also gamma arasenol. Because black cohosh contains active constituents that can increase progesterone synthesis, but also tones down the effects of estrogen on the uterine smooth muscle and even on breast tissue. The proven dose, 80 milligrams at a standardized grade of 2.5% triterpenes. Soy extract can also tone down the effects of estrogen on uterine muscle and also on the breast, and it can also enhance estrogen detoxification and slow the synthesis of estrogen. All of this is helpful. Usually soy extract at a dose of 100 to 150 milligrams in that capsule should be a standardized grade of 20% isoflavone content. And then gamma arasenol from rice bran oil helps to regulate other hormones in the menstrual cycle. A dose of 150 milligrams of gamma arasenol, very helpful. So let me tell you a quick story. I had a patient who had really severe menstrual cramps 2 to 3 days prior to menstruation. She would cancel all her business meetings, make up excuses because she was so embarrassed. She would lie in bed for 2 to 3 days in agonizing pain. I recommended the combination of black cohosh with soy extract and gamma arasenol. It solved the problem in the first month. She's never looked back. She has no more symptoms. In fact, she says her menstrual flow now sort of sneaks up on it or catches her off guard. She has no warning symptoms. Other supplements that have been shown to be helpful, a high-potency multivitamin that has a B50 complex, 400 IUs of vitamin E, 500 milligrams of calcium, and also magnesium at 200 milligrams. And you can also add an additional calcium-magnesium supplement to that, because double-blind studies show that these particular vitamins and minerals also can help tame PMS symptoms. Another supplement that's been shown to be helpful for PMS symptoms is chasteberry. What about dietary modifications? Well, the goal is to reduce prostaglandin series 2 synthesis and help to reduce estrogen and get it into balance with progesterone. How do you do that? A low animal fat, high fiber diet. A low animal fat diet alone has been shown to relieve PMS symptoms in certain women. And women who sort of switch from a high fat diet of 40% calories from fat to just 25% calories and went from 12 grams of fiber to 40 grams of fiber saw a 36% reduction in their serum estrogen levels. We know that vegetarian women on a high fiber diet excrete 2 to 3 times more estrogen, have estrogen levels in their blood that are 50% lower than meat eaters, if you will. And they also report fewer PMS and menstrual cramp problems over their lifetime. So here's what I want you to do. You should try to avoid high-fat meat products and high-fat dairy products. Reduce your intake of corn, safflower seed oil, and also sunflower seed oil and vegetable oils, like mixed vegetable oils. Avoid deep-fried foods and foods with a lot of trans fats and really super sweet foods that are highly glycemic. They can cause inflammation. And alcohol can cause inflammation too, to try to minimize your alcohol consumption. There are certain foods that reduce inflammation that can be helpful, like eating more fish, having a supplement that has fish, flaxseed, and borage seed oil. And also, if you're going to stir fry, use sort of rice bran oil in a salad, you might want to use olive oil or canola oil, even flaxseed oil. Other proven treatments that have been shown to reduce menstrual cramps, double-blind studies show that chiropractic treatment of the low back can help. Why is that? Because nerves from the low back go to the uterine muscles. Even just small misalignments in the low back can irritate those nerves and cause increased pain and increased production of prostaglandin series 2. Studies show that correcting those misalignments with gentle manipulation significantly reduces menstrual cramps and lowers blood levels of prostaglandin series 2. Acupuncture has also been shown to be helpful. What's great is that sometimes a chiropractor that you see might be able to do the manipulation and the acupuncture together to get it all done in one office visit. But that treatment plan has been shown to be very effective. So I think that all women who have menstrual cramps should see a doctor of chiropractic for a spinal examination. Overall, the studies show that it can be very effective. So when you combine all of these natural remedies together, you really get the best results. Put all the strategies together that I spoke about, and that will help to reduce your requirement on certain medications that are often used for menstrual cramp pain that sometimes can damage the liver, damage the kidneys, or increase your risk of internal bleeding. So if you can reduce your risk of those drugs, I think it's in your best interest. So I hope you found this helpful. I'm Dr. James Meschino. Thanks so much for watching.